you're not familiar with our organization, we do three basic things. We provide support, education, and advocacy to both people in recovery from mental health conditions as well as their caregivers, and policymakers and providers. So in the form of support groups, we have our family support group, which is intended for caregivers, and that can be parents, it can be siblings, whoever is caring for someone with a mental health condition, that's the right fit for them. We also have what we call our connections support groups, which are intended for people who are in recovery from mental health conditions. Those come in three different flavors, which is one for veterans, one for young adults ages 18 through 29, and another one for just the general population of people in recovery. Last but certainly not least, we have our Child and Adolescent Network support group, which is intended primarily for parents of school-aged children, or caregivers. Sometimes it's the grandparents who have the kids. So that's support. And these support groups are all facilitated by people who are not only trained to facilitate a support group, but people with lived experience. These are people who've actually been down similar roads. So not only can they provide the resources for people and the knowledge and understanding of what someone is likely to experience in this space and what they can do, but they can empathize with the person because they've been down a similar road. Last but certainly not least is, or I should say not last, education classes. We have a wide variety for caregivers as well as providers. Specifically for caregivers, we have our Family to Family class, which is a wonderful class. It's 12 weeks, talks about medications and what they do and their side effects. It talks about the different types of mental health conditions, what the typical symptoms are and behaviors associated with them. It talks about coping skills, which I found personally really helpful when my son was sick and my wife and I didn't know what to do. Talks about not only how to take care of yourself as a caregiver so that you can be of help to someone, because obviously if you're all stressed out and in crisis, you can't help anybody else because you're just trying to deal with your own stuff. But the coping skills was wonderful, and it really helped me be a better resource for my son when he was struggling with these illnesses. The NAMI Basics class is a similar class, but it meets only for 6 weeks, and that's intended specifically for parents of school-aged children, because kids primarily spend a great deal of their time at school, so that's an added dimension to the whole trajectory of a recovery, is how do you help the child navigate the day-to-day at the school. You know, there may be an individual education plan in place, and meetings with the school staff and guidance, and just how do you navigate that, what are your rights, what can you expect, and what are your resources if you're not getting what you really need. So that's a great education class for parents of school-aged children. Certainly last but not least, we have our provider ed training, what we call Perspectives, and that is for mental health providers, whether it's social workers, nurses, even doctors. It's information that they can use to understand how to utilize the caregiver, the family typically of someone with a mental health condition, to better understand how to use that resource in helping the person with the illness, because the illness doesn't just affect the person, it also affects the family around them. And the family can also suffer from trauma in addition to the person with the illness, and understanding the dynamics and the different stages that people go through, you know, anger, denial, sadness, grief, and ultimately advocacy is very important for the providers to know, because you know, you may have a husband and a wife and a child who is ill, and the wife can be grieving, the husband can be angry. There's a lot of dynamic things that are happening in that space, and to understand how that all plays out is really helpful for caregivers, because they don't teach this stuff in the medical schools. This is kind of new ground that we help bring to the table to help the provider become a better asset to the person who's in recovery as well as the family. Last but not least is advocacy, We're very active at both the federal, state, and even the local level, dealing with legislative advocacy issues. These are typically proposed legislation that is either helpful to the people that we care about, people with mental health conditions, or in some cases, harmful. Typically, in any given legislative session here in Connecticut, there's usually at least one or two bills that we consider a violation of people's civil rights. Understanding that there shouldn't be laws specific to people with mental health concerns that are different than laws from someone suffering any other health condition. To give you an example, typically in any legislative session there always seems to be some proposed legislation that wants the towns to be able to identify a group home and have the power to approve or disapprove that. Now, this being America, let's face it, nobody gets to pick their neighbors. That's just not how Americans roll. But to be able to say you can or cannot cite a group home here is really not a good thing. It's actually a violation of the HIPAA laws, which state that, no one's health history is anyone else's business but that person and their providers. And it's also a violation of the ADA, the Americans with Disabilities Act. So we've been quite successful in fighting those types of negative, harmful legislative bills when they come up. Some of the more positive things we do is we certainly support things in the area of, better coordination of services and more money for services for the people that we care about. We certainly been very supportive of supportive housing. Housing that's helpful to people that are trying to work on their recovery. It's not just housing. Supportive housing is the physical housing, which could be anything. It could be an apartment building, it could be a free market rental, standalone rental unit in a condominium complex, it could be a single family home, multi-family home. It doesn't really matter what the housing is, but it's the wraparound services and the rental subsidies that make it supportive housing. And the wraparound services can be literally anything that will help the person have a more meaningful recovery. That can be supportive employment, medication management, a caseworker, Meals on Wheels, whatever the person needs to really effectively work on their recovery. And we let the person kind of decide what that's going to be. And last but not least, the rental subsidies to make it all work. So we've been very successful here in the state of Connecticut. Connecticut is actually a leader in supportive housing. They effectively ended chronic homelessness with veterans a little over a year ago, and we're working on doing that in conjunction with a lot of other really great ending homelessness organizations to affect that. In fact, I would be remiss if I didn't mention the fact that NAMI is a member of a couple of different coalitions that have similar legislative goals. The Keep the Promise Coalition is one. That was an organization that NAMI, in conjunction with the Connecticut Legal Rights Project, was instrumental in bootstrapping back almost 20 years ago. And it was created because at the time Connecticut had just come off of closing 2 of the 3 state mental institutions because frankly they were expensive and people would be warehoused there. They really wouldn't get better, and it was just in some cases an abusive situation, and it just wasn't good, and it was very expensive. When they were closed, the idea was the state was going to take the money from those organizations and build a robust community-based mental health system. But this being Connecticut, a funny thing happened on the way to the forum, and all that money somehow wound up in the general fund, and they didn't put out or create this robust community-based mental health system that was promised. So that's where the name Keep the Promise came from. And from those very humble beginnings of those 2 organizations, Connecticut Legal Rights Project and NAMI Connecticut, that organization is now over 100 organizations strong, a lot of advocacy organizations, a lot of the psychosocial clubhouses, a lot of the supportive housing and ending homelessness folks like the Connecticut Coalition on Homelessness and the Partnership for Strong Communities, Reaching Home Campaign, people like that are part of this wonderful, robust coalition that, again, looks to foster better mental health services and more funding for these services, as well as they mobilize if there's any kind of legislation proposed that would harm this demographic that we care about. Another coalition we belong to is the Connecticut Cross Disability Lifespan Alliance. And this is a group of people that are all about helping folks with any number of different types of disabilities, including a mental health condition, to again fight for more services as well as fight any legislation that would be harmful to the people that we care about. So that, again, is a very brief overview of what we provide. And we do this, again, not just from our state office here in Farmington, but through our local affiliates. We have affiliates scattered throughout the state. We're all the way from Windham County to the southwest corner of the state, NAMI Southwest. We've got a new affiliate coming online in Danbury this year. Another new affiliate that will hopefully be online by the end of this year, our first Spanish language affiliate in Meriden. NAMI Manchester is very active. We have NAMI Shoreline, NAMI Elm City, NAMI Southeast, it's headquartered out of the Norwich area. NAMI Farmington Valley has been a very robust affiliate. And there's a NAMI Waterbury affiliate as well as a NAMI Newington affiliate. I hope I'm not leaving any. Oh, NAMI Fairfield, that's another robust affiliate. So we've got 10 plus Danbury coming online, which will make 11, and again, the Meriden affiliate, which will be hopefully coming on later this year. And that's how we reach people. That's where we deliver our classes. That's where we deliver our support groups. And you know, the people that are involved in the local affiliates are part of our advocacy network. So when we do have a piece of legislation that's coming up for a public hearing, and we need to rally the troops to come out and give testimony at a public hearing, those are the people, our members and our affiliates, that we reach out to come up to the Capitol and tell their stories and hopefully influence the legislators to do the right thing when it comes to any kind of piece of pending legislation that affects the people that we care about.